Just got back from rounding. It's about 9:30 or so. This morning, basically, I just had to round at a few hospitals, and yeah, rounding is one of those things that never ends. So if you haven't seen my previous videos, essentially rounding is when a physician or doctor goes into the hospital to see a patient. So if a patient is admitted to the hospital because of a hip fracture or because of something like a tumor in their spine, well, they're going to be in the hospital for some time. And even surgical patients who we operate on, until they recover, those patients are in the hospital. So someone has to see them, someone has to care for them and order their labs, order x-rays, EKGs, interpret their labs, order the physical therapy that they're receiving, and just kind of overall manage their care. So essentially rounding is when I am going to various hospitals to see patients, and sometimes this may be 2 hospitals, this may be 1 hospital, this may be 4 hospitals. So as a surgeon, depending on the patient's insurance, depending on which hospital you have credentials at, which means that you're allowed to do cases or allowed to see patients, will dictate which hospitals the patients will be at. So one day I may have a surgery at one particular hospital that is 20 minutes away. Another day, or even that same day, I may have a clinic which is another 25 minutes away. And then I have to go see patients at another hospital which is 15 minutes away. So most surgeons operate at a number of different hospitals. You do have the certain positions where surgeons, they may operate only at one hospital, but a lot of surgeons, especially in private practice, I'm credentialed at maybe 6 or 7 hospitals. So there's a lot of hospitals in the area that I go to and operate, depending on a lot of different things that come into play, including the patient's insurance. Certain hospitals only take certain insurance types, or the insurance carrier will tell the physician and patient, hey, you need to have your surgery done at this hospital. So lots of different things that come into play, but when these hospitals are spread out like this, that is when I try to be efficient with my time. And people ask me, hey, how are you so efficient, and how do you accomplish so much with your busy schedule? So I usually tell people you have to be very efficient. And one of the ways I did this in med school, as a resident, as a fellow, and even now as an attending, is I utilize that time between these hospitals. When I'm driving 30 minutes from one place to another, if you add this up, at the end of the day, I probably spend, if I'm busy that day, hour and a half in the car, especially when there's a lot of traffic. So a key to being efficient is to make use of that time. During this time, I don't try not to listen to music. I think that's just wasting time, especially as a busy person. You should be very efficient with your time, and it doesn't matter what profession that you're in. If you're in, if you're an attorney, if you are in business, you own your own business, if you're in sales, make use of every single minute that you can throughout your day. And that's how you're going to be successful, and that's how you become very efficient. So during these trips, I usually listen to podcasts about finance, about investing. I listen to various lectures on spine. There's a pretty popular procedure that just came out, or it's becoming more popular. Maybe it's been out for a while, but I was just curious about it. And during my drive this morning, I was listening to a lecture about it. So instead of sitting there reading a book, now I'm a little bit more versed in this procedure. I can talk about it to my patients. I can kind of communicate with other surgeons about this procedure because I heard a lecture on it. And I did this while driving. It's something that you have to do anyway. So you have to get from point A to point B. So there's lots of other different YouTubes that I just put on the audio. I'm not sitting there and watching the video, but I'm listening to various things. Then there is DataCamp. This video is sponsored by DataCamp. Thank you to the people over there for sponsoring this video. But DataCamp is an online learning platform that you can learn data science and programming. You know, data science is one of those things that no matter what kind of field that you're in, learning how to understand the data and then analyze this and then use this data is really important for whatever profession that you're in. DataCamp has over 300 types of educational courses that you can take. The good thing about it is that you can utilize their platform when you're on the go, whether you're on the metro, whether you're driving, whether you are waiting for your professor to start class. They have these bit-sized lectures that you can use to learn data science. So definitely check them out. I'll put a link in the description so you guys can learn more about DataCamp. But thank you, DataCamp, for sponsoring this video. So that's kind of my tidbits when it comes to making efficient use of your time. That's what I've been using over the last few years, and hopefully you guys can incorporate some of those tips into your daily lives. The rest of the day, I am heading out to a ranch, which is not too far away from where I'm at, and I have a friend who owns a really large ranch. I think it's like 500 acres. We're just going to go out there and do some shooting, just as some targets. No hunting. It's not hunting season yet, but maybe try to catch some fish in the tanks out there. I believe there's some catfish out there, and just hang out, get away, be real close to my phone, and yeah, that kind of concludes what we're going to do today. So it's just something that I love to do, is basically anything outside, and I have a friend that I will be going out there with, and we're just going to go hang out and catch up. So we'll catch you guys soon. All right, so we're here in D'Hanis, Texas, and a ranch here. Came out here to hang out for the day and do a little fishing, a little shooting some targets as well. Check out my boots. These are my boots from the military. We had to put our blood type on the boots. I'm O positive when we were in Iraq, and I usually wear these when I'm out places like this. This is what we're doing today. Life outside of medicine. But you guys about to check out Surgeon Cowboy.
Big time. No man. Diamonds in my teeth, I got a lot of shine. Running up the number, that's a lot of crime. Try to take it from me, must be out your mind. I'm big time.
We're down here in D'Hanis, Texas. Got my 22 Ruger. Shooting that little target right there. Little malfunction.
Sneak right past the man of a drink. She asleep on my ass. That's a hard pass. I don't need a hard pass.
Surgeon Cowboy.
Snakes in the tall grass. And I don't wanna play with. That's a raw fact. Stay a hard head, make a soft. Big time. Number 9. Diamonds in my teeth. I got a lot of
sound. It means I'm hitting that target.
Running up the numbers. That's a lot of crime. Try and take it from me. Must be out your mind. Oh, I'm big time. Lot of slimes.
Very nice.
Smoky in the air. That's a lot of pine. Pockets running over with the dollar sign. Try and take it from me. Taste my trip. Riding in a spaceship. Work 5 days straight. Go to sleep on day 6.
Just hanging out, enjoying the day. beautiful ranch with a nice sized tank, some catfish out here. So we caught one catfish. We just they're not really biting today, but hopefully we can catch some more. All right, we're down here in Texas. About to pick a shotgun. Dr. Webb, with a shotgun. Right there.
Smoky in the air, that's a lot of crime. Pockets running over with the dollar sign. Yeah, try and take it from me. Don't do it. Watch your back. Watch your mouth. Don't do
Bullseye.
Yeah, it says with the 22. People be like, that's not a shotgun.
Oh yeah, I said shotgun.
Yeah, you know how people are they're real critical, like that's not a shotgun.
Oh, here, do it again then. Okay, that's where I'm shooting at.